Welcome back to Fox 51 today. Do you have all sorts of questions about your healthcare coverage? Well, we've got the answers for you today. Dr. Guy Danielson with Precision Spine Care has all the answers. Okay,
Good morning.
Dr. Guy, what are some of the difficulties in our healthcare system?
Where do I start?
Oh, man, yeah.
Well, you know, the problem is that our system has really changed. And I've been here quite a while. And early on, medical care was kind of like a little cottage industry, and now it's a great big business. And along with that is the fact that just about everything has changed. And excuse me, the practical matter is that in our country, the health care statistics, they're not good. We're ranked 37th in the world in terms of quality of medical care, and our death rate is about 10 years. We die 10 years younger than most of the countries in Europe. So there's many reasons for this, but what we are trying to do is come up with solutions and come up with ways that we can get around this.
And what are some of those solutions?
Well, first of all, the main solution is that we as patients are going to have to take the responsibility for taking care of ourselves. You know, the way doctors are now, if you go into the doctor's office, most doctors have 10 minutes to see a patient, and most of that time is spent looking in the computer and not really being able to address major issues. And so if we're patients, we've got to be prepared for that. We have to have a little list of what we want. We need to be very attentive to watch our time, and we have to be informed. We have to know. We have to take the time to learn about our own medical problems.
Now, obviously, with the new health care law, that you hear the good, the quote-unquote good, and the bad. What are some things maybe you and your colleagues are saying? Do you see some nuggets in there that are good? Because you hear so much, well, it's not, going to do a whole lot for us. Or can you comment?
Well, yes. There's a lot of good things about health care. It's not all bad.
Right.
There are problems, but
sure.
First of all, we have one of the best medical systems in the world when it comes to acute illnesses. For example, if you're in a car wreck, you go to the hospital, you can get amazing care. If you break an arm, if you have some kind of an acute problem, injury, that sort of thing. The problem is not in the acute care, it's in the chronic care. Most of the illnesses that get us down are the diseases, chronic diseases as we get older, diabetes, cancer, heart trouble, those things. And those are the ones that are hard to treat because we just don't have the time to do it.
Now, say you're a patient out there, you've been confused by all of this. Do you have any main, points of advice for us to make sure we get the best health care possible?
Well, the first thing, like I said, the first thing you have to do is be your own doctor. And that means, I think back about what Mickey Mantle said sometime in his life. He wasn't very old when he died, but he said, I wish if I'd known I was going to live this long, I would have taken a lot better care of myself. Well, we now know pretty much that we are going to live that long, most likely. And so taking care of ourselves is the key thing. And the interesting thing is we were talking about the chronic diseases. The best treatment for those diseases, turns out, regardless of what it is, the treatment is almost, and the way to manage it is almost always the same, and that is you have to eat right, you have to exercise, and you have to control your stress, and you have to have the ability to get information. There's lots and lots of information out there, but it's just a matter of digging it out.
Well, thank you so much for stopping by this morning. We'll have more information on our website. Thank you so much.
Thank you.
Thank you.
Coming up next year on Fox 51 today, Bill Rancic is joining us live via satellite. We're going to talk and give you some advice about up-and-coming business owners. That's all when we come back.